Hi everyone, my name's Erik Bohlin and I'm today going to talk about my personal journey through chronic pain and what I learned, the phrase TMS, tension myositis, and this was a term that Dr. John Sarno used back in the 70s to describe the process where your body takes repressed emotion, specifically rage, sometimes guilt and fear, and channels it into body tissues. And I didn't know I had this, but each day I discover something more about myself. So it really began, the beginning of pain, or something what I would call chronic pain. I had a back surgery in 1997. I had, now I understand, a big emotional event in my life just a year earlier, but didn't really connect the dots at all. Ended up with left hip pain. It started off with a little bit of numbness in my left leg, and then it traveled up to back pain. And so I went to a doctor. They saw an MRI, through an MRI scan, and saw that I had a herniated disc and L5-S1. I lived with this for about a year, trying every kind of thing imaginable, ointments and creams and stretches and physical therapy and massage, and it kind of worked, but it really didn't. In fact, that's where I came across Dr. Sarno's book, Healing Back Pain. From there, I tried it. It made a lot of sense to me. I had the personality that fit to a T. The personality being over-functioning, overthinking, overly responsible, a goodist, as he put it, that the person's so good, they just can't let any unpleasant emotions out. And that was me. So I tried his approach, which was to not go down the path of anything physical, because he says that the more you run down the path of physical means of healing, that it's working. He says that the body pain is a distraction from what's really bothering you. So I tried this for a little while and it kind of worked, but I ended up with back surgery. So then I'm good to go for a while, until about 2000 I developed diverticulitis, had an inflammatory process that happened, and the doctor said, look, at the age of 36 you should just get the surgery because it's probably the best thing to prevent something more tragic and more inconvenient. So I had the surgery, and then they found a carcinoid tumor in my appendix. This caused me to overfunction on that. The doctor said it was fortuitous, but in my mind that tends towards anxiety and OCD thinking, I thought, well, how can I prevent this from happening? You know, kind of a control approach. So I went to a nutritionist. And of course, I knew logically that nutrition might help, but it's not a direct cause and effect. But I said, will it hurt anything to do this? So, no, other than I went down the path of being gluten-free and dairy-free and eating a pretty good diet. This was in 2000 to 2002, and then I kind of eased up on that. But I then got TMJ after visiting a dentist. It was pretty severe. Like, how do you do this? Like, I couldn't put my jaw down. I mean, and I kind of OCD that. I got stuck on that. Couldn't really chew because I lost my bite. And this was after a simple dentist procedure of a crown. After 3 months of this, and even after visiting even after visiting a mouth massage therapist that was trying to relax these muscles, and I didn't want to go down the surgery route, but the dentist said, you might go to this oral surgeon. So thankfully, this guy was quite good. He looked at me, I don't even know if he looked at much. He just said 80% of the time these things go away. And guess what happened? It went away. Then I ended up having a shoulder pain. My right shoulder was so sore I couldn't move it. Well, I had a CPAP machine, and I thought the cause was me trying not to hurt the $2,000 CPAP machine with water and everything. And so I laid there very stiff all night trying to be, I guess, good at this. And it was painful, like excruciating. And then I realized I was so frightened. I mean, there's a fear factor, like I need to use my right arm. It'd really kind of be nice. And how can something hurt so bad when I had no physical injury? Like, I didn't even know it wasn't that bad. I mean, like, I can't point to anything I did to hurt this. So I'm seeing my physical therapist, who I saw earlier from my back, and we're 4 weeks into this. I had special devices attached to doors to be able to crank my hand up there. I'm in tears. And one day he says, oh, you know, a lot of these things just go away on their own. I never went back. I mean, I went to see him for something else, but it's like it just went away. I thought, this is weird. This is incredible, but I never really connected the dots. Then, as I'm continuing to be a busy therapist, very busy practice, I had a bout of anxiety attacks. I realized sleep is good, and I was busy working on websites till 1 or 2 in the morning. I would get up at 7 and hit the day running and just go. And I tended to do a lot of too much stuff for the family. Like, I was there to do all this stuff. It was just too much. But I didn't realize it was too much. My body was saying, no, you can't do all this. But it came out in anxiety attacks, so then I went walking, exercise, which then led me to discover neurofeedback, which was great. It helped take away the panic attacks. I lost 50 pounds. In fact, I went to the gym and I was exercising, and there was no fears of hurting myself until I started to have a little bit of back pain. My father had passed away, and that was a stressful event. And it was even stressful afterwards with putting together financial paperwork to do things, and then my mom's now alone, and so adjusting to that. Well, I ended up starting to get back pain in 2014 and 2015, 2016, and it doesn't really, it comes and goes, but I got to the place where I was kind of afraid to do basic things like get into a car, get out of a car, get in and out of bed, off and on the toilet, in and out of the shower. I started to concern myself with sitting just right, so that in a right chair that wouldn't hurt my back. It was very difficult to bill and do the work I needed to do, billing, paperwork. Actually difficult to sit and to even do some of my work as a therapist. So the more pain I had, the more fear I had, the more fear I had, the more pain I had, and it just continued to get more and more. I also developed, I didn't want to use the phrase because I was afraid of another diagnosis, but I felt, well, I had irritable bowel syndrome. And so going to naturopathic physicians, and they are good, but I will say that, you know, the bigger picture is this was emotional for me and I didn't realize it. But I went down the path of looking at foods that might cause, well, not good, unpleasant feelings in my gut. And this triggered the earlier feelings of being in a hospital for 8 days after colon surgery. So I stayed away from cane sugar, I stayed away from mushrooms, from almonds, dairy, anything with wheat or gluten. I couldn't have yeast or tortilla yeast. The list went on and on. I couldn't have according to the naturopath, she says, well, you don't want to eat citrus either. And I've tried and can't find anything on that with Candida. I was told I had Candida. Went on the diet, didn't feel like tons better, but I stuck to it for 2 or 3 years. And I was good at that. I mean, I did not waver. Why? Because I did not want another attack. Because it was very, very unpleasant. There's a lot of nerve endings in the gut. In fact, it's probably because that's where the seat of a lot of our emotions kind of are there. In addition to this, I had cold spells where I was just so cold, and I had heard of this. But how can someone be so cold all the time? But I was cold. And I thought, well, maybe I have thyroid. I didn't run to a doctor too quickly to figure that one out, but I was fatigued. I was tired. I was having night sweats. I was just having general muscle weakness. There were times my hands were shaking. I had then developed plantar fasciitis, which my wife had for a brief time, and I thought, gee, my feet really hurt. Talked to not a doctor about it, but went online, looked at what was on YouTube, and started to do those exercises. Also looked at shoes and changing shoes out and orthotics. And it's funny, the list goes on, but I'm putting these together now, but before I had the solution, I did not understand what I understand now, that these are all really related. So I think this brings me to the discovery process. So my wife ends up with cancer, thyroid cancer. In her healing journey, we decide to go to New York for a fifth opinion, I guess we could call it, just to see what's the best form of treatment. And I will say, having been to New York before, I was not really thrilled about going. And I share this in another video. But I picked a book up off the shelf because, plane trips were very nerve-wracking to me. Just the thought of being on a plane for how many hours and getting through security and getting the luggage in the overhead compartment. And then we're kind of frugal, so we flew into New Jersey and then take a train in, and we do all that. Of course, with my anxiety and catastrophic thinking, and we get there, but this time it was different, totally different. I mean, just like so different, it was shocking. I read this book, Paradoxical Relaxation by David Wise. I had the book on my shelf, tried to read it before, never really got through it, but this I couldn't put down. I realized that the stress was really related to me and how I approach life. Well, this is kind of surprising and humbling to say. I'm a therapist. You would think I would have discovered that sooner, but it is what it is. So here I am in Central Park and relaxing and just having a better time of peace than I ever can imagine. Now, in his book, he brings up Dr. John Sarno. Oh, by the way, on a side note, ended up having, and this might be TMI for some people, but I think I'd rather risk being helpful to people, an enlarged prostate. Went through the scare of doing biopsy, thinking maybe there's cancer. No, there's no cancer, but it's enlarged. I choose not to do any testosterone treatment because I just don't want to mess with more chemicals here. But the doctor was beginning to share this idea with me in my last visit that maybe muscle tension could be actually related to enlargement, and that somehow vigorous exercise might help. Then back to David Wise, that's his specialty, and he wrote a book also called Headache in the Pelvis. Okay, so I also had urinary distress, and sometimes I would go to the bathroom 20 times a day, and I'm not kidding. I would go, and then I'd have such urgency I would have to go again And it was like craziness, craziness. So, back to my experience in New York. I'm there, I read the book, he mentions John Sarno. Somehow a big connection happens. So I start to read John Sarno again.